Every year, about 2 million Americans get an antibiotic-resistant infection. They cause about 23,000 deaths and a huge amount of suffering and healthcare costs. The problem is getting worse because more and more bacteria are developing resistance and because we don't have very many new drugs to treat these infections. This is an issue that Pew has been working on for a number of years, both by advancing policies to reduce overuse of antibiotics in industrial agriculture and in healthcare, and by advancing policies that will stimulate the development of new antibiotics. One of the partnerships that we're really excited about is with the Centers for Disease Control and Prevention. We're working with them to set a national goal for reducing overuse of antibiotics. As with any problem, if you want to make progress, you have to measure where you're at and set a goal. So with the CDC, we're working through the data. For example, how many prescriptions were written for sinusitis, for bronchitis, and so on, and then bringing together groups of experts to say how much of that is necessary and how much really could be avoided. The work that we're doing with CDC complements the President's strategy on antimicrobial resistance. It's really one of the pressing public health problems of our time. It's bad now and could get quite a bit worse if new resistant mutations suddenly emerge. So we have to tackle it, and the good news is we have really unprecedented energy now with the administration's strategy, with the engagement of a lot of stakeholders, and the Congress that's looking at legislation that would stimulate the development of new antibiotics. So it's also a time for hope.